This slide is going to show the hand of the upper limb. So the bones of the hand are going to include the carpals, carpus, metacarpus, and phalanges. Carpus is really the same thing as saying carpal. And there are 8 bones that make up the wrist, the carpals. And you may or may not have to know these for lab, but the easiest way to remember them is with a memory trick. And there's 2 rows of 4. The first row is lateral to medial. And one way that I like to remember this is some lovers try positions. And then the next row is that they can't handle. So you, again, may or may not have to know these. Maybe there'll be extra credit on your lab, something like that. You don't need to know them for lecture. But there's some other mnemonics you can look up as well. Some of them are not G-rated, so I can't share them. The metacarpals, which are the palm, remember, are going to be long bones. They're named 1 through 5 from the thumb to the little finger. The base articulates with the carpal and the head with the proximal phalanges. The phalanges, each digits 2 through 5 are going to have 3 bones, distal, middle, and proximal phalanx. Digit 1, which is the thumb, has 2 bones and no middle phalanx. So the fingers are the digits, the phalanges, number 1 through 5, starting at the thumb. So our next slide is going to show us the images of the right hand. And again, you probably don't need to know the carpals, but they are the short bones. Remember that the radius is going to articulate with the thumb. The phalanges are named from proximal to middle to distal, and you usually have to name them 1 through 5 and say whether it's proximal, middle, or distal. And then the first phalange only has proximal and distal. The metacarpals are numbered 1 through 5 as well. The last part coming up is the lower limb, but before we get to that, we want to talk about a homeostatic imbalance that involves the carpal region. This is called carpal tunnel syndrome. I'm sure you know of somebody that has this, or you may even have it, but it happens because those carpals are so small and they tend to form a tunnel that's formed by ligaments through the wrist. And what can happen with inflammation or overuse of those tendons is it can compress the median nerve, causing tingling and numbness. It's something that someone could get from lots of writing or perhaps lots of typing. So the median nerve is going to travel through the carpal tunnel. For the lower limbs, we again begin with a girdle instead of the pectoral girdle. We're going to begin with the pelvic girdle. And the pelvic girdle is formed by 2 hip bones. And we know now that a hip bone is called a coxal bone, or os coxae would be the more scientific term for it. The sacrum, though, are part of the axial skeleton, so be sure not to mix that up. But the hip girdle attaches the lower limbs to the axial skeleton, transmits the weight of upper limbs to lower limbs, supports pelvic organs, and most importantly, it does have less mobility but more stability than the shoulder joint. And one of the reasons for that is it has a much deeper socket, which is called the acetabulum. And it has 3 bones called the ilium, ischium, and pubis that are all fused together. When we look at the diagram of the pelvic girdle, the hip bone, we can see the majority of it is the ilium, the most superior bone. The most medial bone is the pubis, and then kind of in between that is the ischium. So ilium, ischium, and pubis. The sacrum and coccyx, remember, are axial. That's very important to remember. So where the two meet, where the axial and appendicular skeleton meet, is the sacroiliac joint. When you put your hands on your hips, you are putting your hands on your iliac crest. We then have certain spines, which are used for, like, for example, chiropractors and physical therapists when they are checking to see if both hip bones are in alignment. They'll check for what's called the ASIS, or the anterior superior iliac spine. Inferior to that is anterior inferior iliac spine, and that is abbreviated as AIIS. On sort of the side of the hip bone, we have the acetabulum. So the way I remember that is I always say, or think, rather, I don't say it, but I say, think, kiss my acetabulum. And that will help you to remember where it's located at. So between the two pubic bones is the pubic symphysis, and that is also fibrocartilage, just like the fibrocartilage that we saw in the intervertebral disc. So let's look at the three bones of the pelvic girdle. The ilium is the superior region of the hip bone, and it has these iliac crests. So when you put your hands on your hips, then if you start with your hands on your hips and you move anteriorly to where you feel a point, that point is called the anterior superior iliac spine. And if you move your hand backwards to where you feel another point, that's the PSIS, the posterior superior iliac spine. In fact, when you look at somebody like a young female that's in a bikini, right above really where the bikini line is, the waistband, you'll see two impressions. And those impressions are, or deep kind of depressions, are where the posterior superior iliac spine is. Also in the ilium is the greater sciatic notch for the sciatic nerve to pass. On the ischium, we have the ischial spine, which is what we sit on. So right now, where your butt is touching the seat, providing you're sitting down, is where the ischial spine is. But the most inferior part is really the ischial tuberosities, because this is where the gluteal muscles attach. Then there is a lesser sciatic notch. The most medial bone is the pubis, which joins at the pubic symphysis joint. There's an obturator foramen, which is a hole for the obturator nerve. The pubic bones join at the pubic symphysis. And then the pubic arch is really key for being able to see the difference between the male and the female pelvises, which we will see on the next video. This is the illustration of the hip coxal bones. So we're looking at a lateral view here and a medial view here. Looking at the lateral view, we see the ilium at the top, and specifically the iliac crest. So again, if you're going to start at the iliac crest and move forward, the part where it forms a spine is the anterior superior iliac spine. You start at the iliac crest and move posterior, you come in contact with the posterior superior iliac spine. And then below that is the posterior inferior iliac spine. And below the ASIS, the anterior superior iliac spine, is the anterior inferior iliac spine. As I mentioned, the deep socket where the head of the femur goes is the acetabulum. We see these notches for the sciatic nerve, a greater sciatic notch and a lesser sciatic notch, as well as ischial tuberosity, which is what we sit on. So when our bum touches the seat, it's the ischial tuberosity. So we can see it on the lateral view here. And then for the pubis, the most kind of medial bone, between the pubis and the ischium, we have the obturator foramen. And that will about do it for the coxal bones.